Titus Mumia. First of all, mmekuwa na moment na Senate just a day ago, alafu mmekuwa mkiongelea mambo mengi. One of the question niliraisiwa ambao ulifikiria kwamba ilikuwa changamoto wewe kujibu ilikuwa gani?
Kwa hizo maswali fact zote zilikuwa tu sawa, lakini ilikuwa tunaangalia mambo ya audit ya 2024-2025 kulingana na ile report auditor alileta. Kwa hivyo tulikuwa tumejiandaa kulingana na ile ripoti kujibu zile maswali ambazo ziliulizwa na auditor ili tu explain baadhi ya vitu ambavyo tulifanya kama hospitali. Lakini zilikuwa tu sawa hizo maswali kwa vile zile vitu zilitendeka kwa hospitali. Yeah, na ni jukumu la auditor kuuliza maswali ili tujibu.
Kulikuwa kuna tetesi mtandaoni zile ambazo zinapita tu kwa mtandao hapa Facebook, TikTok, nini na nini hapo zamani, sijui kama sasa bado iko, kwamba kulikuwa na wadudu, hizi ni rats ambao walikuwa wanaingia mortuaries wanakula macho ya watu ambao wamekufa. Did you ever hear of that thing before you after umekuja Vihiga? Because I think as a CEO of Vihiga Referral Hospital you've been there for maybe 2 or 3 months. Have you heard of that? Did you hear of it? And maybe what is the stand about it?
Kusema kweli sijaambiwa, lakini najua nitaambiwa kama zilikuwa. But ile standard tunataka tukuweke pale ni kuhakikisha, unajua ile chumba cha kuhifadhi maiti ni kama tu chumba chochote, kwa vile tunapeleka watu ambao wameshaaga hapo, na si ati kupenda kwao kuaga, lazima tuwapee heshima ile ya mwisho. Kwa hivyo sitarajii siku yoyote ya kwamba rats zitakuwa hapo, na pia tuko na modern actually funeral home. Kwa hivyo sitarajii, na tuko na dawa zile za insects, na kulingana na mimi sioni kama itawezekana. But hapo awali ile hali ambayo ilikuwa na ile mortuary ya mzee, hapo ningesema kungekuwa na uwezekano. Yeah.
There is another concern just hapo kwa mortuary, as you before we even go to the mortuaries, hiyo tutakuja kwake baadaye. You came to Vihiga 3 months. Almost 3 months was zimeisha. You've been in office as a CEO since Vihiga was made a parastatal. What was the biggest challenge ulipata, and what was the situation of the hospital, and maybe some of the changes you've put in place?
Yeah, one thing, unajua ukifika mahali lazima usome hiyo place ili ujue utaanzia wapi. Kwa hivyo the first 1, 2, 3 months I've been there. It has been just planning to see, because unajua ukiharakisha vitu pia unaweza kosa kujua yale ambayo inaweza kusaidia kubadilisha maisha hapo ama vile watu wanafanya kazi. Ile changamoto kubwa, unajua saa zingine kila mtu anataka kufanya kazi vile amekuwa akifanya. Na mimi pia nimekuja nikijua hapa ni lazima to improve services. Kwa hivyo watu wamekuwa kinisoma, mimi pia nikiwasoma. Kwa hivyo tumesomana mpaka sasa tumesema sasa ni lazima tuanze kufanya kazi.
But there's a place where mlifika mahali mkakaruzana, because there's a time walisema kwamba kuna wafanyikazi ulikuja ukafuta. Na mostly the story online was ulifuta wafanyikazi ambao walikuwa Vihiga, ukabeba wafanyikazi kutoka kwingine ukakuja ukaweka Vihiga. Hata wale ambao sijui mahitaji hawa locum wakapiga kelele sana. There was even a demonstration, they wanted even to plan a demonstration, wakasema umefuta kinyume na sheria. It was a high one. Kwa nini ulifuta watu wa Vihiga ukaleta watu?
Unajua hiyo ni swali ambalo unajua wale ambao wote wako pale.
Yes.
Naweza kuambia hata siwajui. Na sio lazima nijue staff. The only thing nataka kujua ni ile profession yake au specialty yake. Kwa hivyo wakati nilikuja ilianza hivi. Unajua nikifika, unajua lazima tukuwe na nidhamu kazini. Na one of the strength I have which I've done hata kwingine, natakanga mimi ni disciplinarian, na ni lazima tufanye kazi kwa mpangilio. Kwa hivyo najua hata ili trend sana wakati nilifungia staff nje kuingia hospitali. Nilienda kwa gate nikasimama hapo.
Ulifungia wafanyikazi wa hospitali nje?
Yeah.
Kwa sababu gani?
So unajua sasa kwa nini tukuje leo kazini? Between mfanyikazi na mgonjwa, nani anafaa apate mwingine? Mgonjwa anafaa kupata mfanyikazi. Kwa hivyo sasa kama mgonjwa ameshakuja na wewe huko, si uende nyumbani ufanye ile maneno ulikuwa unafanya alafu kesho ukuje. Kwa hivyo Nilikaa hapo ikifika saa 2:05, akasema sasa hapo mrudi tu nyumbani mfanye yale ambayo mlikuwa mnafanya, alafu kesho mkuje, na ukikuja sasa upitie kwa ofisi yangu niambie kama ulimaliza, na pia sasa niambie kama serikali inafaa kulipe, kwa vile unalipwa kama umefanya kazi. Na hiyo attitude pia imekuwa kitu ya kutatanisha sana. Kwa hivyo mimi hapo ndio nilianza kutembea kwa mtandao, wakaniita majina, wakasema hii ni moto ya gazeti, makaratasi itazima tu, lakini kwa uwezo wa Mwenyezi Mungu bado inawaka na itaendelea kuwaka. Sasa itakuwa ya si hata karatasi.
Truth be told, before you came to Vihiga Referral Hospital, there was a number of issues that were being raised. Kulikuwa, watu wanasema ilikuwa mbaya sana. Kulikuwa na cases every day, negligence, no doctors in the hospital. Watu wanakuja madaktari hawako, sometimes hakuna madawa hospitalini. Then you came in. Did you find a culture shock? Because najua ukikuja ulikuwa umetoka Kakamega General Referral Hospital, where yes, there were changes we saw. When you came to Vihiga Referral Hospital, did you get a culture shock or it was things you are used to?
Yeah, you know, when I decided to take up this job, I had to also to learn. You know, you learn, you ask questions, you go there incognito, ili ujue hao watu nitafanya kazi nao aje. Kusema kweli pale Vihiga ni sio hospitali kubwa, lakini kuna culture shock. Hiyo ni ukweli, kusema ukweli.
Which one was the biggest culture shock?
In fact, unajua ukipata pahali ambapo kila mtu anajua kila kitu, na tena mtu anafanya vitu kulingana na vile anajulikana ama anajuana na watu. So one thing is Godfather, hiyo mambo Godfather syndrome. Hiyo imekuwa hapo sana, kwa sababu ukifanya kitu utatishwa ati nitaenda kuambia mwanasiasa fulani, nitaambia nani. So na nikaput it clear ya kwamba sasa mimi hapo ni hospitali. Sasa kama kuna Godfather mahali popote, uamue aidha tutafanya kazi ama uende ufanye kazi na Godfather. Kwa hivyo tulianza hivyo, na najua tena vita si ati inatoka nje, ama hii mambo ya kutofanya kazi ni ile culture tumeinculcate kwa wafanyikazi wenyewe. Kwa hivyo utapata watu wakuji kazi, wengine wanaleta wale wadogo ndio wanafanya kazi, hao wameenda kufanya locum kwingine ili wapate pesa extra. Lakini sasa najiuliza, si tufanye tu kazi wakati uko free, uende ufanye nini locum kwingine? Kwa hivyo hiyo ndio ilikuwa shida, lakini tunapambana tu polepole kwa sababu ukisikia mtu anasema, wakati umesema sasa wale hao wafanyi kazi, we take action, alafu kuambie ati sasa umetutoa kwa sababu unaleta watu wa Kakamega, unajua hapo umeanza kugonga ndipo, kwa vile kuna kitu unafanya. So na mimi nimekaa kwa hii kazi kwa miaka kadhaa, na najua ya kwamba fairness is number 1. Then number 2, ni lazima tuhakikisha kwamba service delivery, actually my area of focus is service delivery. Nimekuja kwa hiyo hospitali ya Vihiga kuhakikisha tumepea wananchi services yale ambayo watu wanasema haitanizuia kuhakikisha wamefanya nini kazi. Na kama kuna staff yeyote anafikiria hawezi, hizo terms ni ngumu sana, kwa sababu naelewa schemes of service ya kila staff, kuanzia madaktari mpaka watu wa chini. So lazima watu wafanye kazi, na wale ambao watapenda kazi tutatembea pamoja, na wale ambao wanaona hawezi fanya kazi, kwa sababu ndugu yangu, how will you explain when a staff has not come to work na kuna mgonjwa pale na anahitaji usaidizi ya dharura? How will you explain to anybody? Tukipoteza maisha moja, one life is too many. So personally, I'm ready to be called names. I'm ready kukosana na watu, lakini bora wananchi wako na mimi.
How many people have you sacked since you came? Wangapi wameenda nyumbani?
Kuna wengine kwenda, watu wameenda, siwezi kadanganya, na bado wataendelea kwenda.
Wameenda kama wangapi?
Ndatafuta idadi nitakupea. In our next interaction I'll give you the exact numbers, because there's no way I go to a clinic, I get you are not there, and these people are suffering. So if you are staff on temporary, I'll just tell you, just go back home. na wale ambao wataki kufanya kazi na mimi wako permanent. We have very many institutions where they can work, and I'm wondering ni hospitali gani tutapeleka Mutulezi. So ni lazima either work na mimi ama ujiondoe wewe mwenyewe.
Them calling that has been on social media, watu wakitupa maneno wakiongea, it's just 2 months, of course 3 months 2 months sio huwezi badilisha two big things, but of course kuna ile watu wanajaribu kuzuia kile kitu ambacho nafanya. There's always pushback to what you're doing. For the 2 months you've been in Vihiga, 3 months to be specific, Referral Hospital, did you find drugs? Did you find beds? Did you find oxygen? Did you find the CT scan? If you did find them, how is the situation? If you didn't, are they there? Or still, because huko wanasema hakuna CT scan Vihiga?
Acha nikwambie ndugu yangu, governor amekuwa akiweka efforts na pesa kwa hiyo hospitali, lakini the people who are somewhere who are determined ya kwamba wanataka kumderail, and then watu wamekuwa wakiogopa kusema ukweli. Wakati nilikuja nikaangalia hiyo hospitali, governor sio shida, chief officer sio shida, tuseme hata waziri, shida imekuwa tu kwa hospitali yenyewe, kwa sababu kuna wengine walikuwa naona hapo ni pali pa kufanya biashara ya kibinafsi. So unapata for example a machine, nikiingia hapo CT scan haikuwa nafanya kazi, na si ati haingetengenezwa, ni kwa vile tu kuna watu walikaa mahali wakati hiyo mashini imeharibika, is a source of income. Wanaenda wanaongea na wale watu ambao wanafaa watengeneze, alafu wanakat ma deals hapo. So wakati niliingia hapo nikasoma, wakakuja nikujia hata ili waniambie na ujui naelewa hizo vitu. Na unajua hii Kenya wale ambao wana supply CT scan, wana supply x-ray, wote suppliers wote hii Kenya I think nawajua, kwa sababu nimekaa kwa hii sekta ya afya kwa muda mrefu sana. Kwa hivyo mtu akikuja kunidanganya nitajua. So walikuja wakaanza kunidanganya. So mimi pia nikakubaliana nao, lakini nilikuwa pia na wasoma. Kwa hivyo wakati niliambia governor ya kwamba hii mambo ya CT scan tutaisort out, nipe muda. Ndipo ukasikia, sijui kama uliona kwa social media, wakati tulikuwa tumesign mkataba na wale ambao wali manufacture CT scan Newsoft from China. Kwa vile nilisema hii middlemen ndio hao watu wafanyikazi wangu wanatumia kuharibu, ili iharibike, tengenezwe kidogo, kesho wakishakula pesa warudi tena tengeneze. So it was a source of income. So nikasema hiyo hapana. So ndipo tukaandikishana na hao wa China wale Newsoft. Sasa tukakubaliana na to make it surprisingly, hao watu walikuja wakatengeneza hiyo machine bila kulipa malipo yoyote.
So is the CT scan working?
CT scan is working, and it is, in fact those are the negative energies ziko. Mtu anaweza kuja hata kwa hospitali atibiwe vizuri, alafu mwingine anatoka anaenda kusema is not been attended to.
So can we agree where we are now, yes, that the CT scan in Vihiga County is working?
CT scan is working, and I can even give you the numbers. In fact, if you need the number, yes, of CT scans which have been done.
How many?
In fact, we've done more than 300 CT scans since that CT scan was yes, more than all manner of. In fact, even the resolution when the CT scan, when I came, it was working like 32 slice. I know you will know what 32 slice means, eh? And then we have 64. So it depends. Ni kama tu kinunua simu. Simu zitatoshana tu, lakini
GB, 64 GB.
Yes. So sitaki kupeleka kwa hiyo maneno ya
hiyo slides nilikuwa nimepotea.
Yes, slice. So right now,
yes,
it is 64. It is working like 64. But you know, those are the funny people who are being brought to make this machine. Actually, they used to put it to work like 32. So, and I was very happy when the radiologist reported to me that he's very happy. And he's very happy. And one thing I can assure you is only that we can't start putting blames. But our reports are done within 12 hours. They come out. In fact, those are normal cases, but emergencies are done immediately, instantly. Because at the same time, I've entered into an agreement with somebody who has a software. So the radiologist can do report anywhere. And what he does is every 6 in the morning, all the reports which were done the whole day are ready, apart from the emergencies which are done, which he does instantly. So CT scan is working, and I can shock you that there are some people from other hospitals who've been waiting for their reports for more than 1 week, more than 2 weeks. They come and redo CT scan in Vihiga, and then they get the result immediately, and they go back to get treated wherever they came from.
What of oxygen?
Yeah,
Oxygen has had a problem in Vihiga for a long time. Has it been sorted?
In fact, oxygen plant, I'm still struggling to sort it out. Oxygen, when I came, the same story. In fact, can you imagine? Somebody has come to repair the oxygen plant, and then a staff tells him, before you touch that machine, I need this amount of money.
So it was all corruption?
It was corruption. In fact, these people were hell-bent in ensuring that governor is not resting. So I've also gotten somebody who is fixing the oxygen plant, and meanwhile we are using the cylinders. There's no way you can go to that hospital then cause oxygen, because we are always on top of things.
So let's say there are cylinders that
Serve for the purpose.
Yes, serve for
but
the purpose.
as you serve that, you sorting out.
I'm sorting out the generation of that oxygen so that we have, because we have done actually piping in all the wards, and even the new building which is coming up, we are piping so that the patients will get oxygen where they are, mounted on the walls. Yes, so that one.
How long can that take? Maybe if you can approximate.
Looking at the resources you have, looking at the work so far done to where you are?
Yeah, you can work with 2 weeks, but I'm working towards ensuring that it is not 2 weeks. The lesser number of days, the better. Once it is up and running, like the CT scan, it is up and running, and I can assure you, if it gets some hitches, within 24 hours we'll be back. And I've got to put a restriction who visit that place. So apart from radiographer and radiologist, and then one biomedical engineer. Not all of them, because some of the issues were coming from biomedical engineers. So that one I've taken care of it the same way oxygen plant. Once it is up and running, I will also restrict the access.
Why do you still feel with all these developments, any other thing, maybe let's talk about the beds and then tell me, why do you feel even with this, we still have a negative energy around Vihiga Referral Hospital?
Yeah, you know, some of us, we are focused on ensuring service delivery, but the people who are focused on ensuring that they have negative publicity. Yes, and to your surprise, some of those people are doing that. With them, when they are sick, they come. We know, they come to the same facility. And outside there, they tell people not to come. So the only thing we will do, we'll invest in actually ensuring that people are well informed. It is lack of information.
There is a concern. I heard it somewhere that before then.
I heard it somewhere that before then, or some time back, there are some workers within the Vihiga Referral Hospital who would even tell patients, don't come here. And then they would have contracts with, or other agreements with other hospitals, direct them there, and then they would get a cut. Is it something you found out true?
That is very true, and I dare anyone to do that. Let them do when I'm not informed, but I will come up with a way on how the public can let me know, so that when such a case happens, because why should we tell a patient to go and be overcharged outside, and yet our services are subsidized? So what we need to do is to, I've talked to the staff. You know, when I went there, I decided to meet each and every department. And those cartels didn't want that, because they thought I was going to be told exactly the facts, and for sure I was told. So what is there? Sometimes I bump into cases from patients, and I'm happy. You know, I will not let people know who has informed me. So whenever I get a case, I will handle it. So negative publicity is what killed that facility. And this is a combined effort. Staff who are inside, plus people who are outside. Sometimes it turns political, because people want to get mileage. And you know, I'm there to ensure that staff are working and patients are getting services. So when I get staffs who are also controversial, I will just let them decide. They decide whether they want to be politicians, or they want to be people who are manufacturing falsehood, or they want to serve patients.
Do we still have
Do we still have cartels in within the hospital, the Vihiga Referral Hospital? Are they still there?
Yes, I can tell you they're still there, but we'll with them. Pole pole. We'll just deal with them one by one. I know they're still there. There are people who are still even telling patients that CT scan is not working. And one day, one told even a staff from the county. So I received a call. I was being told that you lied to us. You are telling us CT scan is working, and yet it's not working. And then when I requested to know who the staff was, I got the staff and I took necessary disciplinary action against them. And imagine, the staff was a lady. So these things are both ladies and men on equal measure. And you wonder, what is the intention?
You are in Vihiga Referral Hospital for service delivery, as you say, but there is a black spot somewhere. Just recently, we had a case online on different pages talking about a kid who died while in the hospital. Later on, you can clarify whether the kid died within the hospital. That is penal. The father is Jeffrey, and they say they waited for some time while at the hospital. Can you clarify on that? Did a child die at Vihiga Referral Hospital due to medical negligence?
Yeah, I got the case, and I'm sorry for that because losing life is not something we can just talk about it and wash it away. Yeah, I'm sorry for the family, and my condolences to one Jeffrey. And this information came to me late, and I made efforts, and I reached out to Jeffrey on phone, and I've arranged for a meeting so that he can also explain his side. But you know, such cases, when they happen, we need to get full story. Because as a CEO, I need to act on something based on the evidence which are there. Yeah, because later on I was told that that child died in another facility. No. The child didn't die in our facility, and that one, it was explained to me by the father.
Or the father later on agreed that the child didn't die at Vihiga Referral
Yes.
Hospital?
In fact, the father told me that the child went to another facility, and the child died after 1.5 hours later.
After they had left Vihiga?
After they had left Vihiga. So I would not want to judge whether my staff or the father. I would want to investigate so that I get to the bottom, and then now I will give my official communication on what actually happened. But if it is my staff who was involved in negligence, or maybe they delayed, obviously I will take action. And I know might not be a good action, because I'm there to protect lives, yes, and to protect the most vulnerable. So once that report is ready, I will take action. But for now, I'm still doing my investigations.
How do you feel when you realize a case happened somewhere and people still say it happened in Vihiga Referral Hospital? What do you think was the motive behind?
Yeah, that's what I told you. People have been sharing with me the posts, and as a CEO, I might not answer such comments. But you wonder what motive somebody can have if the father, the child, has admitted that the child did not die at our facility. And then, some people might think they're doing good, but they're doing even more harm to the parents, to this child. They might think that they want to ruin the reputation of the facility. But an hospital is not a place where you can just start joking around, because all of us, including myself, I'm a potential patient. So when we say that that facility is bad and patients, when they go there, they die, it is us killing our own facility, because you'll find people there's something called self-seeking behavior. Self-seeking behavior, it is like, you see these small hospitals, dispensaries, health center. When patients or people hear that there are drugs, they will go there. Everybody will be sick because there are drugs. But the moment drugs are being depleted, then they don't go. So I wonder, were they waiting for the drugs to come is when they're sick? But that is the behavior of how people behave. Now, with us, we are trying to encourage people to seek medication at the hospital. And others are busy telling people that there are not drugs, that was for people died there. And yet, silently with them, they come to the facility.
But there have been claims that drugs at Vihiga Referral Hospital have not been there, that people are forced. They go, some patients say, tunaenda tunapewa Panadol, and then they are referred to go and buy those drugs outside the hospital. Is the pharmacies working in Vihiga Referral Hospital? Oh, before you came, was that the case? Did you find drugs in the hospital? And are there drugs in hospitals so that even if everyone goes in today or someone goes in today, they would find drugs there?
You know, if you want to know the drugs are in the hospital, it is very simple.
Yes.
The most critical areas, accident and emergency. When you go to accident and emergency and there are no drugs, people will say, because they will not be attended to, they will be turned away. There are some basic and critical drugs. Another area is maternity, because that is where mothers come every now and again. And in the whole world, there's no single hospital with all the drugs. You know, drugs, what happens is we look at the conditions in a given area, like Vihiga County, for example, or Western region. Then we list these conditions, number 1 to last. So that's why we talk about essential drugs. So these drugs, we'll supply them depending on the number of ailments within that region. So and then the ones which are number last, you'll find we bring less drugs, because if you bring equal amount, what will happen? Expiry of such drugs. So you will find that there's one drug which is going to be consumed by 3 people in a month. So you bring that drug lesser quantity. But when another person comes and finds that that drug, single drug, is not there are no drugs in the hospital. So what I can tell you, when I came, I started working actively in November last year. And I can tell you I was prepared for December, because many things happen in December.
Did you find drugs in the hospital?
In fact, I got drugs, but there were no enough drugs, but not because there was no money, but it was back and forth. You know, these people were also clever. They didn't want even drugs to come. Governor could hear on social media that there are not drugs, and he asked, but you've not told me there's money, we can get drugs. So that is what I said, I must physically see.
Can we conclusively say the biggest threat that led to this bad publicity and the drop of Vihiga services is political interference?
That is a precise. In fact, it is politics, because of people don't want to see good things. They want everything politicized. That is what has brought Vihiga where we are. But with God and whatever efforts we are putting, I can assure you, Herman, is that we are going to go places. And the target population are the most vulnerable. Those people who don't see social media. Those people who are innocent, who are sometimes told things which are not there because they have never come. You know, a hospital is not a good place to go. So you find yourself there. You just find yourself there. If I told you, even if I told you to go to hospital, you sleep for 1 day, you'll ask me whether I'm okay, because what are you going to do there? So when people come to the hospital, they come because they are actually facing challenges health-wise. So, and I can tell you, you know, people are busy, like those politics we are talking about the hospital is not working. And can I tell you that, and I surprise you, you come to that hospital, it is full. It is full. In fact, sometimes patients are sharing beds. And I can't deny any patient opportunity. Even if they're sharing 3, I will let them share, but each and every person to get attended to.
Is there a plan to expand, have more beds maybe?
Yeah, in fact, I just came the other day when we were at 160. I can assure you we are at 242.
Oh,
and have reached out
November
to
you are 160 beds.
Yes.
And now you are 242 beds. That's
Yes.
an addition of about 82.
82, and in fact, I've reached out to KMPDC, who came and confirmed. And the other thing is Safaricom M-Pesa Foundation also helped us to come up with the mother-child hospital, which is just separate. In fact, our mothers and babies have their own hospital, and it also increased the number of bed capacity. So since I came, we have increased the capacity to 242. That is an addition of 82 beds. And even that, having realized that, we still have issues on accommodation of our patients. So we are planning that immediately the new plaza, and I'll invite you to see. We are going to add 300 more beds, so that we'll be at 500. 42 or 550 there. So that one is a step. In fact, let me tell you, people are just talking. I've worked in very many hospitals, and we talk in this country. Vihiga is doing very well, I can assure you. Besides these noises you are hearing, this politics you are hearing, Vihiga is doing very well. And in fact, if you want to know, ask the professionals who are not corrupted politically. They will give you the real story about what we are doing at Vihiga. So I can't compare with which county or which hospital, but I can assure you Vihiga is doing very well. We might not lack challenges. Challenges are there, even in my house, in your house, anywhere.
Challenges,
yes.
I tell you.
Yes.
Especially when you don't have money.
Yes, when you yeah, there are very many challenges. So, and even if we brought those people who are talking about services and poor at Vihiga, if you gave them the office I sit in, they will not even take 3 days. In fact, not even 1 day. They will run away. So talking is easy, but now when you are given that opportunity, and I thank the governor for giving me the opportunity to serve, and also I'm given time to work, because you know, somebody can give you work and then he has tied your hands. So my hands are not tied. I'm working, and he has given me all the powers to make decisions, so that at the end of the day, he's supposed to ask me, I gave you the opportunity, why didn't you perform?